As an emergency doctor, you're supposed to be able to take whatever comes your way. Sick, crashing patient in cardiac arrest comes to the door. I'm trained to be able to deal with that. But then if I have a patient who is literally waiting for days to go off to a higher level of care, or for a bed upstairs in the emergency department, I don't see patients, I see family. And I have the 98-year-old patient who's waiting for 36 hours to go upstairs, and I go and check on her when I get the opportunity. How is she doing? And she looks at me and says, this bed is really uncomfortable, and I know she's probably going to develop pressure ulcers sitting there in our emergency department on an uncomfortable bed. I don't see a patient, I see my grandmother. It's not up to you, these things, when you're sort of stymied because you can't physically create a bed for a patient that isn't there. You can't magically clone yourself so that there's a second physician on whenever there are 20 people in the waiting room and you have a crashing patient you have to attend to. I've actually had patients ask me, what can I do? Because I can see you're the only doctor here. I can see all these people waiting, and we think you're doing a great job. Like, how can we help you? As a province, I think we need to go to our government and we need to explain that, there are things that can be better and that should be better. So as a patient, you actually are not powerless in this equation. So you have an opportunity to have your voice heard. And we as emergency physicians will advocate on your behalf, but your voice is the most important voice. So help us make it heard.